What if, just for argument's sake, many of the private ambulance companies were to go out of business? The question is, who's going to be there to help? Well, that's the claim of some private ambulance companies and their ambulance workers here in California. And that's where we begin our broadcast with a special report as we investigate the ambulance reimbursement Medi-Cal crisis.
The wages are just not sustainable. They're at poverty level.
There is an ambulance emergency of sorts looming in California. This emergency involves private ambulance companies, Medi-Cal, and what some claim is state bureaucracy and mismanagement. These ambulance companies and some of their EMTs, emergency medical technicians, are now in a battle with Medi-Cal. Medi-Cal is California's state version of the federal Medicaid healthcare program. Medi-Cal insurance is designed for low-income folks. If you can't afford insurance here in California, the state gives you Medi-Cal. So how does this all relate to ambulance service? Well, critics argue the collateral damage of this poor reimbursement is the ambulance worker's paycheck, the low wages, in many cases anywhere from $15 to $17 an hour. To give some context, an entry-level worker at a restaurant or retail store can make more money than an EMT, the people who save lives. These same critics of Medi-Cal in the state of California argue this is causing a public health care crisis in the Golden State. Many private companies now say they can't recruit emergency medical technicians or keep them, and that's going to have a ripple effect within the healthcare industry.
We have not had an increase since 1999. If you think about the wages in 1999, they were somewhere in the $6 range. We are paying at least 400% more in wages. And it's been extremely terrible because the Medi-Cal, California has the highest Medi-Cal population. And so every time we are transporting a Medi-Cal patient, we do it at a loss.
Melissa Harris serves on the board of directors of the California Ambulance Association. CAA is comprised of ambulance companies all throughout the state, both 911 and interfacility transport. The organization is designed to provide a unified voice when dealing with things like legislation, policy, really anything related to EMS, emergency medical services. Harris is also the owner of AmbuServe in Gardena, California. Her ambulance company serves several different communities all throughout Los Angeles and Orange County. AmbuServe operates 50 ambulances, and the company has about 300 employees. 250 of those are EMS care providers.
$111 per transport. Most states pay 5 times more than what California pays. 75% of ambulances' overall expenses are wages, since we are on call 24 hours a day. And so when we have these large populations where we're taking losses on 30 to 40% of our transports, it affects our ability of income and how much we could make to support paying a living, thriving wage. It has never been more difficult to retain employees as it is today. I've never seen shortages all across California of EMTs just leaving the workforce because the wages are too low, they're burnt out, they're working a lot of overtime, and so we really need to have an increase so we could pay our employees what they're worth. You know, every day they're risking their lives. We have EMTs that work, 24-hour, 48, 72 hours. They miss all types of family commitments. They can't be home. They're trying to do whatever they can because they love what they do. And it saddens me to see people leave this career.
Medi-Cal now represents over 40% of ambulance service dealings in just the Southern California area alone. Ambulance providers like Melissa Harris are required to contract with Medi-Cal despite the reimbursement schedule. The intention of Medi-Cal is honorable. The state program was designed as a safety net years ago here in California to make sure low-income folks had access to health care. Today, Harris grades the state of California A for effort, F for execution, where private ambulance companies are concerned. She explains that whether a patient has Medi-Cal or they have the premium plan of health insurance, or they pay out of pocket, California ambulance companies obviously have to serve everyone, whether patients have money or not. And the companies basically have to take what they get, so to speak, in this case, the $111 from the state Medi-Cal reimbursement. Harris says this financial formula causes problems.
We don't get to pick and choose which patients we transport. We arrive on scene and we're here to serve and take care of the community. And so when you're getting such a low reimbursement, other payers like commercial insurance and private pay, we have to charge them so much more than what we should be charging them to offset all the losses every time we're taking a Medi-Cal patient. It's extremely difficult. I mean, it's not just EMTs. We provide paramedics, so advanced life support. We also employ nurses and respiratory therapists, and we compete with hospital staffing for nurses. So you could imagine, just in wages alone, how expensive it is to transport a patient in an ambulance. And also we provide medicine and we stabilize the patient during the transport.
And beyond that, often EMTs have to spend hours at the hospital with a patient until there's a doctor or a room available so the patient can be processed and medically evaluated. You can't just drop off a patient and then leave them alone at the hospital. So this adds extra hours to the frenzied pace. This labor-intensive work schedule, coupled with the low pay, now has some ambulance workers fleeing this industry. We asked some local Southern California ambulance company EMTs their opinion of the Medi-Cal reimbursement. Given their hectic EMT schedule each and every day, all the people they take care of, the lives they save, the miles they travel, is this Medi-Cal reimbursement fair?
As an EMT, we want to help people, we want to serve the community, but we might not be able to stay in that profession because we're not making enough to support ourselves and family.
I do have such a great passion for the field, and my job has been so fulfilling in so many ways, but the reality is being an EMT is not financially sustainable. So as much as I would want to be an EMT, it's not enough for me to support myself on my own. So the reality is that as much as I have a passion for it, it's not a sustainable option to make a living here.
Obviously, I think it's pretty unfair. I feel like EMS is a super important part of any community. So knowing that that rate hasn't changed at all for like 22 years it's kind of sad to see, because it's such an important part of like everything.
Shelley Huddleston represents thousands of EMS workers in California, Nevada, Arizona, and Hawaii. Huddleston is the national labor representative for the International Association of EMTs and Paramedics. She's not just your average union rep, so to speak. She's been in the trenches.
Got my first EMT certificate in, I'm going to age myself, 1990. From there, I went overseas as a military wife and I worked in the emergency room. And then I came back in 1993 and I got a job as an EMT in San Bernardino. And then I went to paramedic school in, I believe, 95. And I'm still a licensed paramedic.
Huddleston knows all too well what many EMTs are dealing with: a lot of work and not much pay. Safe to say Huddleston is qualified to fight for the rights of her fellow emergency medical technicians. She says she's outraged over the fact that California now has a massive money surplus these days after the Biden COVID bailouts, and yet the state can't take some of that newfound money and give private ambulance companies and their respective workers better reimbursement.
To do such a risky, high liability job, they could go to Starbucks or to Target and make more money. And so we're fighting for them to be paid correctly, to be paid for what they do, for the professionals that they are. We are fighting to get the Medi-Cal rates raised so that the companies will get a higher rate increase, and hence it would trickle down to the employees who are the ones out there actually running the calls. I believe we're asking for $350 for a total. That's nothing compared to what some of the other states are getting that are getting $500 and $600. So I think it's a fair ask.
We have never seen as low recruitment as we see now. And what happened is you have tons of employees that are working tremendous amount of overtime and they're just burnt out. They're just exhausted. And so we really need the state to step up and give us an increase and show us that we are your heroes and you're worth what you do.
Now, I contacted the state of California requesting an on-camera interview for their take on all of this. I emailed DHCS, that's the California Department of Healthcare Services. They declined an on-camera interview, saying they did not have a representative in LA. So I offered a Zoom interview, which they also declined. However, Anthony Cava, who's the spokesperson for the Department of Healthcare Services, did send me a written statement to answer some of my questions. The written statement says in part, and I'm quoting here, DHCS reimburses Medi-Cal providers of ground medical transportation services in accordance with state and federal law and must adhere to federal requirements in implementing any changes to the California Medicaid state plan. Additionally, DHCS evaluates and continually monitors provider payments to ensure compliance with federal access requirements and maintains the California Medicaid state plan as approved by the Centers for Medicare and Medicaid Services, CMS, end quote. The statement goes on to say, in part, DHCS is authorized to establish reimbursement rates for ground medical transportation services in accordance with applicable state and federal laws. The add-on and supplemental payment programs described above increase total reimbursement to providers, and total reimbursement is a more accurate representation than only evaluating base rates. The regulations for medical transport reimbursement do not include requirements or limitations on ambulance companies related to salaries and wages for their employees, end quote. Wow. For the record, I appreciate that DHCS sent a statement. Thanks for that. Although I was just hoping for an interview with state officials so we could have a common sense conversation and they could answer some questions and talk about a possible solution. What they sent, to be honest, was basically state of California mumbo jumbo, legalese, legal jargon, which takes a medical expert and a Harvard lawyer to decipher, certainly which I'm not. Unfortunately, and I'm going to be honest, California state officials have a bad habit of not going on camera and answering tough questions. So I emailed them again, asking if they could send another statement, just simplifying everything for me and our viewers. I never heard back from them. Well, joining me now to discuss a possible solution and explore this further is Democrat California State Assemblyman Freddie Rodriguez, representing Pomona, Ontario, and other parts of San Bernardino County. Assemblyman Rodriguez, who is the chairman of the Assembly Emergency Management Committee, worked for over 30 years as an EMT. He was awarded the California Star of Life recognition for his volunteer contributions and life-saving rescues. Assemblyman Rodriguez was elected to the State Assembly in 2013, and now he's leading the way to pass legislation to increase Medi-Cal reimbursements to ambulance companies throughout the state. Assemblyman Freddie Rodriguez, the perfect person to talk to. Thank you so much for being here.
Thank you. It's a pleasure.
Listen, Assemblyman Rodriguez, I have to be honest and I apologize. These folks were running from the camera. What they sent me was crazy. Your opinion, am I being too harsh, or do you get what I'm saying, Assemblyman Rodriguez?
I get what you get 100%. I mean, shame on them for not coming to you to meet you regarding some of these questions. I think you had some good questions there, and it's shame on them for not giving you just a plain basic answer to the question, right? Being from my point of view, I mean, over 30 years in the industry, I can tell you a lot about some simple fixes as this bill I'm trying to do right now, AB 55.
We're going to get to that in a moment, the Assembly bill. First, though, Assemblyman Rodriguez, ironically, correct me if I'm wrong, the state of California now has a surplus of money thanks to the Biden blue state bailout, as I term it, during the height of COVID. We all know that. Any fair and objective observer must admit the state of California, look, over the years, they've squandered so much money, billions of dollars. There's been, I've reported on it, misappropriation of funds from state lawmakers, not you, sir, but let's be honest, California certainly likes to spend money. President Biden, well, he erased all that with the red ink that was here in the Golden State with the bailout. So, look, California has money, Assemblyman. With that extra money, why not just give a bit more to the ambulance companies? Am I oversimplifying it, or is there something to be said there?
No, you're absolutely right. I mean, just think what a small portion of that money could do to these men and women out there running these calls day in and day out, help them maintain a sustainable living wage, and really be able to recruit more people to the industry. As we all know, they're suffering from shortages as well. But if you pay people right, take care of them, I think you'll be able to retain more and get more folks coming and working for your industry.
You know, it's also kind of ironic. It's somewhat frustrating given the fact that California has, I want to say, the highest property tax, highest sales tax, the gas tax, the business tax. I mean, really the most insane taxes anywhere is here in California. Shouldn't this state be able to send some extra money to the ambulance companies, not with the bailout money, but just with all the taxes that the state collects?
You're right. And I think it's one industry that's overlooked and many times, just as we're talking about right now. We're looking for a small investment that could really help this industry that once again operates 24/7, day in and day out. I don't think people really realize how important this industry does as it provides service and care to many folks across the state.
Speaking of that, can you give our audience an idea? I mean, I tried to explain it somewhat in my field report earlier, but the reimbursement rate, as far as California, let's say, versus other states, do you have some data for that comparison? For example, I believe in my report, I was talking about the fact that isn't the reimbursement rate something like $400 some odd per ambulance trip in Arizona, as opposed to, what is it, the $111 from Medi-Cal here in California? Because California, it's the 46th lowest of the 50 states for private ambulance reimbursement, Freddie.
You're absolutely right. Once again, shame on folks. Think about California. We're always the leader in many industries, right? Moving California forward. In this case, we're not. How can Arizona, a state like Arizona, pay over $400 for the reimbursement rate, and here in California, a little over $100? That's obviously upside down. Definitely, we're not the leaders in this industry as we are talking about now, and that's why I introduced AB 55 to hopefully close that gap. And once again, California be the leader, especially when it comes to these reimbursement rates here for our ambulance providers.
So with that said, Assemblyman, you're leading the charge to try and affect change. Can you talk about that in some detail for our viewers?
Yes, but just recently I implemented AB 55. AB 55 will increase the rate to $350. It's still short from what Arizona, but it's a huge increase from what we're currently getting now. Currently, like I said, it's a little over $100, but my budget request to be looking at increasing it to $350, and hopefully we can get more, but at least that's a start.
The obvious question, are ambulance companies able to even keep these EMS workers, these great brave EMTs? I mean, it seems like it's an impossible chore that's being asked of them given what they're paid. Although, I guess to defend the state of California, is that being overstated or embellished, or in fact, is that the case? It's just tough to hire and retain these folks.
I think it's tough to hire and retain them because of their wages, right? They don't make good enough wages as other industries. We talk about fast food workers and other industries, but yet this industry is one industry that's always overlooked. And really, if you pay them more, the chances are they're going to stay and give her better working conditions as well, and able to recruit and retain more folks as well.
Despite the fact that state of California officials ran from the camera, did not interview with me, I'm also going to defend them, because what we do on this program is fair and honest, and even if they run from the camera, I am going to defend them and try to be very balanced. With that said, then why not just, in defense of the state, why not have ambulance company owners, let them pay their workers more? Maybe they can take on some of that responsibility and not rely so much on the state. Everybody is begging the state of California, the begging government for money.
Yeah, we know it's difficult in this industry that we work and talk about, the ambulance industry. I mean, one thing is they're transporting a lot of patients still that don't have insurance, the indigent population. So they're taking a huge loss as it is. So why not look at these reimbursement rates for Medi-Cal to help bump up their salaries and be able to keep and retrain employees, right? It's a win-win. And once again, this industry operates 24/7. Nonstop. It doesn't matter what's happening in our world economy. People unfortunately get sick, get hurt in accidents, and we have patients that need to be transported from one hospital to another, and there's the ambulance companies that do it no matter what.
If I'm not mistaken, there's another challenge for these private ambulance companies. Correct me if I'm wrong, Assemblyman. Aren't these private ambulance companies vying for the same money as some of these city fire departments and their ambulances? Because I know the city fire departments need money as well. And if that is the case, how is this affecting the private companies? In other words, are they vying for the same dollars? And is the state possibly favoring fire departments over these private companies, Assemblyman Rodriguez?
Well, when you talk about those two agencies, we got the local fire departments, and then you got the private sector EMS. So they're kind of a little bit different. They do the same, but you got to look at the private sector EMS. They rely on a lot of non-emergent transports, right? Those patients that go maybe from one hospital to another, a skilled nursing facility to the hospital, dialysis centers, right? Those are what you call non-emergent. So that's not going to affect a city fire department that are responding to basically 911 emergency calls, right? So it's a little bit of difference of type of service they're providing, but yet they're the same. They're trained the same. They have the same licenses, and really some private ambulance companies are contracted with fire departments to provide the 911 service as well, just depending on the jurisdictions. But it is a little separate, but they're doing the same calls. Just once again, the private sector EMS are the ones that are going to be impacted the most because of the non-emergent transports they do. And a lot of those have the Medicare and the Medi-Cal only type of insurance. So that's why it's really vital and important to increase these rates to be able to pay those employees a livable wage.
Final question, Assemblyman. There's another challenge as well. I was reading that, listen, in California, it seems fire season is all year round. It's not just a season. Struggles probably get worse for these private ambulance companies during fire season, because now I'm guessing these private EMS folks, well, they have to take care of some of these massive wildfires, so to speak. Could that be causing a problem? Because could it be leaving, let's say, fewer ambulance workers elsewhere when people need them the most?
Yeah, well, that's a mutual aid agreement we have up and down the state. When these disasters are declared, a lot of the private sector ambulance companies are contracted with the counties to provide what they call strike teams to get dispatched to these areas of disasters, right? To supplement the local fire departments and the county departments there. So yeah, it could have a ripple effect, especially when we're short-staffed already as it is, providing the care on the emergency 911 calls, and even those skilled nursing facility calls, or rather they refer to as the non-emergent calls, right? They're short, so as in a major disaster is declared, you got to move some of those resources to these mutual aid programs that they have throughout the state. So it could be an impacting on some of these areas. So just depending the location and how severe these disasters are.